was introduced to Dr. Gold through a very important event called the White Coat Summit that she held on the steps of the Capitol. And this is back when COVID was raging, the world was upside down. And me as a doctor, I was actually real fearful of what was going on in our country. And I was also fearful of the disease, right? I think we all can relate to that because we were all there at one time. But I want to tell you, I tuned in to her White Coat Summit, and I could see that she had the best interest of the patient, right? That is why we are here with Gold Hair. We are in the best interest of the patient. There's no hidden agenda. There's no backdoor. There's no big financier that's hoping that we snag somebody in. And when they presented their data, right, you guys remember that. They presented just objective data on what they were finding. She had speakers from all over the country. They came in. They talked about what was working, right? What was working for the patient. When the patients were coming in, they were sick. They were needing help, and what was working. And I have to say that I was so impressed. In fact, I went out and read the same research. I got educated about what was going on. And then I just started treating clients as if I was part of the Gold Care team. And there was no Gold Care team at that time, right? It was just a collected group of like-minded healthcare providers that were interested in finding out what was working for patients and how we could put those patients first, right? And we started treating people, various platforms, right, all over the country. And we started seeing success story after success story. And I became very thankful that Dr. Gold was out there. She was fighting the good fight, right? She was out there in the public eye. She was taking the spears, and I know that there were spears from all over the country, all over big pharma, all over big government, unfortunately, and she took them. And she dedicated her life to treating the patient. And I took that to heart.